really enjoyed the Patient First training session. For me, it was about going back and having a real look at what patients think and feel.
All of our patients have a huge number of emotions and feelings, and we need our staff to remember what it is like to be a patient.
You become very complacent looking at your own area, and it was nice to see things in a different way and be able to share experiences and good practice.
It's the sharing of those different outlooks that actually lead to a better overview of the patient experience.
Our staff find it really sort of interactive. They're coming together as teams, but they're also then mixing with other staff that maybe they wouldn't meet.
We try to get as many different groups of individuals together, so that may be some of the doctors, the nurses, some clinicians and non-clinical staff as well.
It's fired up a lot of our staff to go on and make some changes, and it's empowering them to do that.
It empowers our staff to make those changes which they identify through walking the hospital and looking through the eyes of the patient.
There are areas which need to be improved within our trust, so by working through this programme and working with our patients, we'll be able to identify those areas.
It's really creative. We use journey maps, and as part of it our staff are given the opportunity to walk in the patient's shoes.
You're seeing the environment in the way that a patient would see the environment. So for example, looking at the cleaning, looking at signage, care's become much more complicated. It's really nice to kind of go back to the basics and really look at the key things that a patient would see.
It's wider than just the signage. We're also looking at the letters which we send out to our patients. We're looking at the information which we put out on the internet.
Everyone should get involved with Patient First. It's about putting patients at the front of our healthcare, which is where they should be, and it's an opportunity to really feel passionately about making a difference. So it's for doctors, nurses, admin staff, everybody, multidisciplinary approach to really make a difference to patients' lives.
All of them, let's say, have been great. I haven't wanted for nothing. I've sat here and they've been brilliant.
The staff have been very good. I think they've been understanding.
The Patient First programme allows us to provide great care to every patient, every day.
We do provide good patient experience, and sometimes we just need to remind people of the great job we do as well. Patient First is a fantastic training opportunity. It really allows you to bring home the values of your organisation, make a personal pledge and see that play out in action.